Morning, Elevation Health family. This is Dr. David Yachter. And today we are looking at coming up here in a few weeks, our very impactful, very popular diabetes and blood sugar control workshop. This is one of our most important workshops and probably our best attended workshop of all year because in truth, and quite frankly, at least half of you watching this right now, half of everybody that you know is either pre-diabetic or actually diabetic at this point. It's so prevalent and so rampant and so insidious these days. When you're least expected, you get your blood sugar test, you get your A1C, and there it is. All of a sudden, out of nowhere, seemingly out of nowhere, it needs some attention. But this is a pretty scary thing because what we're finding today is most of these diseases that develop as a result of diabetes and high blood sugar being driven day after day, all year for decades, it's on the rise. It's developing for at least a decade before it's diagnosed. So I think it's important that we dive into this today, really get a better understanding of what's happening and maybe what we can do to be on the proactive end of this. So we're going to talk about diabetes do's and don'ts. And, when it comes to diabetes, the biggest concern isn't so much the disease of diabetes. It's really the other diseases that are actually caused by it, namely cancer, dementia, Alzheimer's disease. These are the things that I'm really more concerned about these days. We all know heart disease and, of course, vision loss, how, the high blood sugar just destroys all the nerves everywhere in your body and your brain. And not to mention neuropathy, obesity, and loss of limbs, amputation. I mean, 60% of all amputations that are done in hospitals today are because of diabetes. So certainly we know without a doubt that this type 2 diabetes is a disease that's 100% treatable, reversible, and most importantly, preventable, 100% with proper lifestyle. But in our medical culture today, a common standard of practice is to treat with medications, and really medications never correct the underlying cause of diabetes. And they also come with horrible consequences and side effects. Insulin, common side effects. This is published in the Journal of Clinical Endocrinology and Metabolism. Type 2 diabetics who take insulin injections die at more than twice the rate of those given non-insulin treatment, studies show. Metformin, another common treatment, drug of choice, was recalled recently over concerns because it was contaminated with carcinogens. Many studies show that taking metformin actually doubles your chances of dying from cardiovascular problems. And again, the same thing, it only treats the effects of diabetes and never corrects the underlying cause. That's why we continue to develop more health problems as time goes on, which requires more medical care, more medications, more complicated procedures, and more problems. So these are the things that, most of the folks that I come in contact with, most of my patients, are looking to prevent and avoid going to more doctors, taking more medications, going to hospitals. So that's why this workshop is so important, that first and foremost, you bring these issues into clear view and have a good understanding of them in terms of what you may be able to do instead. Because after all, your life actually literally hangs in the balance. And it may not be, a short-term thing. It may be a longer-term thing, but it's the difference in most cases between whether or not you live in an extra 10 years or not, all the years that God hadn't expected you to live and created you to live. So these are the choices that we may need to make, better lifestyle choices. One study showed, there was a large study of more than 10,000 diabetics that used aggressive blood sugar lowering medications, which actually caused more deaths. And on the other end, this diabetes prevention research program group that they did showed that the lifestyle changes that they employed with the people in the study were even more effective than diabetes drugs such as metformin in reducing the incidence of diabetes at people with high risk with lower costs and fewer side effects. Really no side effects when you're talking about lifestyle changes. So this is exactly what we're going to be talking about at this upcoming diabetes and blood sugar control workshop, strategies you can learn to reverse type 2 diabetes. In as little as a week, we've seen that actually happen. So this is not shooting from the hip. These are actual clinical outcomes that we have seen, not just in our office, but it's very, very common. It's a well-known fact today that type 2 diabetes is 100% reversible if you apply the proper strategies. How to stabilize your blood sugar at any age, doesn't matter. How to lose your easiest 10 pounds ever. How to have better energy, prevent Alzheimer's, cancer, heart disease, and the top 3 research-proven blood sugar stabilizing supplements, not medications, supplements. All of our patients are always asking me, especially when they have trouble with their blood sugar, managing their blood sugar, what supplements can I take? And this is what we're going to talk about at this workshop. I want to read for you a heartwarming testimony from one of our dearest patients, Marilyn. She says, I've been seeing Dr. Yachter, and I've had such great results. I want to share with him and everyone how grateful I am for his services and knowledge that he uses to help us on our wellness journey. Dr. Yachter offers a once-a-month free lecture which covers a different health topic each time. It's fabulous, and I learn new things that I apply to my health and routine. I would not miss this valuable gift he's given to us. In the past 6 months, I've lost 23 pounds. I'm off insulin, and I exercise an hour or 2 every day. Other things I've noticed is I have improved sleep, better digestion, a calmer mind, clearer thinking, more flexibility, and better posture since I've been under chiropractic care. She says, health is truly a journey, and I'm fortunate to have such a practitioner to guide me on this path. Thank you so much, Marilyn, for sharing that. That's so encouraging for me because, you know, my goal, as I always say, is to help everyone on this journey. As you get older, the goal is to get healthier. And as we say, we're on our way to the mountaintop. Whoever's on their way, who wants to take the ride, follow me because we're going there. Make sure you're here at this upcoming workshop. It's going to be life-changing. You're going to learn all about this and a whole lot more coming up at our Diabetes and Blood Sugar Control Workshop, Tuesday, June 13th at 5:45. See the banner below for our phone number. Call the office. Make sure you're registered for yourself, family members, loved ones, guests, whoever it is. We'll save seats for you. But it's important that you register because this will be standing room only. So if you're in the office now, make sure you make your way over to the front desk, get your names down, your friends or your guests, whoever's going to be there. Make sure we start registering early. Registration is open now. And thank you so much for joining me today. I look forward to seeing everybody there. It's going to be awesome. I love and appreciate you. God bless.